Hi, it's Dr. Jen. I am going to go through the instructions for the 1-day stool test from Genova Diagnostics, okay? So 1-day stool collection kit. So this is given to you by your friendly integrative medicine doctor, and you open it up and this is what it looks like. And we're gonna go through everything and all the steps. So first you need to have gotten a requisition form, and this is what it looks like from the doctor, okay? And they will put diagnostic codes and then also everything that needs tested. And then I'm gonna go through all the instructions in here, okay? It's pretty straightforward. So you have different tubes that you're going to see in here, okay? And they all come in different bags. So this is the green top. You're going to have an orange top. You're going to have a pink top. And this is the orange chart tube. This is the swab tube. And then you're going to have the clear top, okay? So you're gonna have all those set out. Also comes with some gloves. So what you wanna do is kind of lay all this out. And then this is the fun French fry container, which is where the stool goes in, okay? And then you have your FedEx prepaid shipping, okay? So we're gonna go through all of this. So the tubes can contain poisonous liquids, so keep out of the reach of children. We don't want children playing with this, trying to drink it or anything, okay? So you're gonna find the labels in here, and you're going to fill out your date of birth to all tubes, okay? And there may be extra labels left over, and that's okay. So that's the first step you're gonna do. Then you're going to also make sure you activate your requisition form by scanning this code, okay? So once you're all set to get ready to get your stool sample, so very important, wait 4 weeks from colonoscopy or barium enema before starting the test. This test is an expensive test, so we want to get the best results and the most accurate. Do not collect if there's active bleeding from hemorrhoids or menstruation, and then check with your doctor about medications that would affect this. So 2 to 4 weeks before, I usually tell my patients to discontinue antibiotic, antiparasitics, antifungals, and any probiotic supplements. If we ordered a H. pylori test, you have to discontinue PPIs, protein pump inhibitors like Prilosec, and any bismuth like Pepto-Bismol. 2 days before, discontinue aspirin or any other NSAIDs like ibuprofen, rectal suppository enemas, activated charcoal, bismuth, bentane, digestive enzymes, antacids, lactatives, mineral oil, castor oil, or bentonite clay. So all of those 2 days before. You want to make sure that you don't overfill. There is a fill line on here, okay? You don't want it too high or too low. If you see a worm, do not add to a stool collection tube. Instead, place it in the green top tube without scooping additional stool. A worm can be placed in a clean glass jar with rubbing alcohol. Do not add additional stool to the jar. Write worm on the requisition, and do not mix and mash sample if there's worm inside. Do not shake the tube if there's a worm inside. So day 1, you're going to, this is just for the day 1, and this is the most common one I do. You're gonna put on the glove. You're gonna collect your stool sample. This picture is hilarious. And don't let urine or water from the toilet get in the sample. So just the poop, okay? This is a stool sample. You're going to use the green tube and transfer the stool sample using the built-in scoop, okay? So you're gonna scoop it up, okay? Like a little project, just playing with your poop. Collect from different areas of the sample. Mix the sample in the liquid until it's as smooth as possible. So you're gonna mix it, and then you're gonna shake it for 30 seconds and place in the biohazard bag. You're gonna do the same steps for all 3 of these, the orange, pink, and clear, okay? And then the swab collection, you're gonna open the swab and place it in the tube upright, okay? Leave the swab in until you're gonna collect the sample, okay? And then you're gonna make sure the swab tip's evenly coated with stool, and then you're gonna put it in there, mix and mash it, break the swab at the top, and then screw it on tightly, okay? And then dispose of the remaining sample into the toilet and dispose of the collection tray in the glove, okay? And then all of those are gonna go in the biohazard bag, okay? So final prep list, record the date of collection, stool consistency, and stool color. Place the biohazard bag with tubes in the outer collection box. Provide the payment information. Complete the health survey. Place the boxes with samples and paperwork in the FedEx mailer. Follow the enclosed shipping instructions and refrigerate the package until you're shipping. No cooling or expedited shipping required. Just make sure you contact FedEx. The big reasons why we sometimes have delay of treatment with these stool samples is that they weren't done correctly, okay? One of the big things that I get back, because I get all of these back if patients don't do them correctly, if there's not enough stool sample, so they didn't fill it all the way up to the line, and because you need 4 tubes, so you need a pretty good stool sample. If the cap wasn't on tightly enough, this is pretty cool, by the way. When I did mine like 5 years ago, they didn't have these little cute, they look like sporks. They're so cute. They look like baby sporks. Okay, make sure this is really tight, okay? Now, the 3-day collection kit. So sometimes I do use this with my patients. It's a little bit more of a pain because what you have to do is collect for 3 days. And not all my patients are pooping 3 days in a row. And then so you get 3 of these. And the only difference is day 3 is actually the same, but day 1 and 2, you're collecting 2 additional green tops, okay? And then you date those. So that's really what makes day 3 different. Sometimes I order day 3 if there's a little bit more of a concern for parasitic infection. However, I have found that parasites are very difficult to always see on these stool kits. They do like to hide places. So that's it. I hope that helps. That is how you do the collection and all the instructions in 2022 for the Genova 1-day stool collection sample.